I'm Jim Nickman. I'm the president of the New York State Health Foundation. I really want to welcome you all here today. We're so pleased to have you. We really value our ability to convene and to communicate what works and what does not work, and really provide a home in some ways for people to debate about how to improve healthcare, as we talked about earlier, to dream about how to improve healthcare, to argue, and to just think up new ideas.
And we're going to start with the gentleman here to my left, Stephen Safyer, who is known to many of you. He's the president and chief executive officer of Montefiore here in New York City. And Montefiore, of course, is the university hospital and academic medical center for the Albert Einstein College of Medicine. It's a full-service integrated delivery system caring for patients from this metropolitan region. Dr. Safyer is an accomplished physician leader, highly respected healthcare executive. He's been at Montefiore for 30 years and previously served as the senior vice president and chief medical officer at the institution. He has been a strong advocate for delivering excellence to the city's most vulnerable patients. He's led the expansion of Montefiore's ambulatory healthcare network and developed a number of innovative business and clinical strategies to provide care under prepayment arrangements. He also has championed the adoption of truly cutting-edge clinical information systems and created nationally recognized quality and safety programs.
Montefiore is an academic medical center, as you said, in concert with the Albert Einstein College of Medicine. I am incredibly proud of the things we do there: heart transplants, liver transplants. We educate 800 medical students, 1,200 residents every year, develop new knowledge, new techniques, and we do those as every other academic medical center of note does in the country. But different than them, we have strived to change. And you make mention of that, but that change is to build an integrated delivery system, not just one big hospital, not one big box. We do now 2.5 million primary care visits and ambulatory subspecialty visits in the community, and 500,000 home health visits, and we actually manage care. We spend north of $2.5 trillion a year on healthcare here. If you do the math for 300 million plus individuals, 60–70% of that money is governmental or governmental tax effect. We're spending twice as much as the other Western countries spend. And when you look at some of the public health markers, we're doing half as good. And we have kind of a single payer already. It's called the government, but we have none of the advantages of a single payer because we're not using the power of the government to regulate what we have to pay for drugs and what we have to pay for the vendors and how we can invest in ourselves. So I think we need to get together, force change in our system, and change further upstream in the government. And that's our job.
Great.
And I want to recognize collectively that change takes investment, it takes time, and you fail sometimes because you learn from the facts on the ground. So the problem with the Congress and the gridlock and the financial crisis is, and in the state, in Albany, is that there are demands to take money out rapidly and not invest in change. And that makes certain things attractive to venture capitalists. I also acknowledge that, to pay for what is a terrific thing, the Affordable Care Act, and insure more people, there's a number of Medicare payments or payments in the Medicare system that are going to be removed. So when I look at the Bronx, where we have 250 or 300,000 without insurance, it doesn't look like the rest of the country. It's skewed towards undocumented immigrants. And they have been precluded because of the toxic issue in the Congress and in the country about immigrants. So there's a lot of concerns I have about the demands we have to do, but there's a lot of optimism I have also. So I'll make it very simple. I think we need to insure all, and I think everybody here spoke to that. And I think getting to a 30 million or 35 million more, that's great. But there's still a large number of people in this country who are in the healthcare system and live in this country, and they need to be insured. First and foremost, we had a discussion here about diabetes. In the Bronx, 30% of the population has a BMI, a body mass index, over 30. And at the Children's Hospital at Montefiore, we have children that are 10, 11, 12 years old that have BMIs over 30. And at 17 and 18 have what we used to call adult onset diabetes. I mean, we're undermining all the public health and community health gains of our population over the last 100 years. This is an epidemic that makes HIV and other epidemics in this country at least look minute. But we can't take our eyes off the prize. We need to come back and institute in this state a tax on sugar beverages because it is way more upstream than our care systems, which need to gear up. I think healthcare is a very regional affair. So places like Brooklyn, the Bronx, Manhattan, Erie County, they need to be thought out much more strategically from a delivery system point of view. And quite straightforward, I think the only way around the escalating expense is to get rid of the fee-for-service system, because the fee-for-service system is pernicious. And it encourages overuse, and it encourages the wrong things, and it encourages more than just the 30% of stuff that isn't even proven. So we need to change that payment system, and we need to do more than just offer a product. We need to encourage the migration to that change.